Hi there. Have you been told that you might need elective surgery for your hip, knee or shoulder, for example? Then this is some information that you might find really useful. My name's Josh, I'm one of the physiotherapists here at myPhysioSA, and this is something that we talk with patients with all the time and give them advice around leading up to surgery and making decisions around that. And it's not an easy decision and it's going to be different for everyone, but there's some things that you might find useful to consider as you're making your decision. So some of the things that are really important is to get some information from your orthopaedic surgeon, but also your GP and a physiotherapist, because all those are going to play vital roles in how you can make that decision and how you recover from any potential surgery as well. When you're going to these appointments, it's probably really good to write down some information. I found that's a really good tip because sometimes you might not remember all the stuff that you wanted to find out in the appointment. If you've got a list, then you can go through that and make sure you've got all your questions answered. So that's a really good point. The other thing is to make sure that you are relying on the information you get from the professionals. You'll probably hear lots of things from family and friends, and more than likely you're either going to hear the really good stories or the really bad stories, and most of the time you're not going to come into either of those categories. So just be wary of that as well. Every surgery is different and it's different for each person and your situation. Some of the things to also consider is that building up or leading up towards surgery, there are things that you can do to help you with your potential recovery before and afterwards. We call that Prehab, and that's revolving around some specific exercises for you that a physiotherapist or an exercise physiologist can help you with, and that can help you to build up your strength and your range of movement and some of your balance or other things that are associated with your specific injury, that can help you to actually feel better before the surgery if you're going to go down that path, or you might even be able to manage things for a while before you even need the surgery and delay things potentially as well. So that's a really important thing that you can work with, in one-to-one with your physiotherapist or exercise physiologist, and that can really change your symptoms and your pain depending on what your issue is. Other factors that you might want to consider as well is how long it's going to take you to get back to feeling normal. So lots of your joint replacement surgery or surgery around your joint does take quite a long time. It can take often 12 months or more for you to actually get back to a really good high functioning level. Most people get there without any issues, but the first part of your rehab is often quite sore and you might not be feeling as good as you were before the operation for a while. So you need to be prepared for that and think about how that might impact your day-to-day routine after the surgery if you did go through with it. Other things to think about as well is how much is it you're affecting your day-to-day life, your problem at the moment, and is it to the point that you can manage things, or can you not manage stuff? And again, that's where you can chat to physiotherapists, and this is where we help people a lot with modifying and changing things so that they can actually manage really well on a day-to-day basis and do all the things that they want to be able to do with some minor modifications and some exercises to help them along the way. So timing is really important. You still might need to have surgery, but now might not be the right time. You might be able to go along for a little bit before you actually need to make that decision. So these are all things to think about. It is, like I said, a complex decision. Often it does need some talking through, some assessment of your particular area and getting good advice from some different areas, including your orthopaedic surgeon and your physiotherapist is really important. So if you do need further help, then feel free to get in touch. Look through our website as well. That's got some really good information around the different surgeries that you might be considering.